The actual definition is still not universally agreed upon. My definition of a concussion is a direct or indirect traumatic force injury to the brain causing a neurochemical imbalance resulting in a constellation of physical symptoms, altered mental status, and altered consciousness. Now, when an athlete has a concussion, these are the typical signs and symptoms that you can see. You may see one of these, you may see more than one, but these are the typical symptoms that you'll see. A concussion is a neurochemical injury. It is a metabolic injury and not an actual structural injury. Basically what happens when there's a great force to the brain, there's a shifting in neurochemicals positions. You have certain neurochemicals that are in certain concentrations and in certain locations in your brain where they're supposed to be, okay? You exert a great force on the brain and all of a sudden those chemicals that are in their normal house where they're supposed to be all of a sudden get pushed out of positions. And it takes time for that neurochemical imbalance to right itself. And while all that stuff is happening, you're exhibiting and seeing symptoms. You're seeing, they're saying, I still have a headache, my vision is still blurred, their memory's messed up. So while that neurochemical imbalance is still on, they have symptoms. That's why concussion symptoms has always been and will always be the most important part of treating a concussion. Do they have symptoms or do they not? Position of catcher is clearly, from my experience for the past 4 seasons, and this is my 5th season dealing with concussions in pro baseball, the catcher position is definitely the most vulnerable position to sustain a concussion. And the two mechanisms are either collision at the plate or taking foul tips that come off and hit them directly in the face mask. Those are clearly the most common, but yeah, so if your kid plays catcher in baseball, they're definitely more likely to sustain a concussion. But as you know, there's no real proven prevention of any of the helmet products that we have now of getting a concussion. And so, but I think it's worth trying to come up with force dissipating type of materials that could result in less force being experienced in the brain. So I think it's definitely headed in the right direction. Again, though, I mean you're talking about such high forces, and if you're not ready for that impact, it happens very, very regularly and predictably. What we know now in concussion care is if a concussion is appropriately treated and fully resolved, then you basically kind of revert back to square zero. The brain is recovered, it heals up, and you are stable enough to go and even sustain another insult. The problem with concussions is if you have a situation where brain injuries are not fully resolved and they're going back and repeatedly having traumatic events to their brain, then you can start seeing some sequelae, some problems, anything that can lead from what's called post-concussion syndrome, which is where those concussion symptoms become significant, problematic, and they last for weeks and weeks. That's the post-concussion symptoms. That is, in fact, as a sports medicine practitioner, you have to almost assume that that's probably the case going on, and so that's why we have to be really crafty in making sure we're being thorough in our evaluation and assessment so that we don't miss that.